But now they're coming out with a new product called 6-methyl nicotine that they're putting into these products, and it's circumventing the FDA's regulation.
Katie, thank you for coming.
Yeah, thanks for having me.
We have been trying to get together since I saw the Save My Family presentation at Eagle Middle School. You work for Central District. We've been talking for over an hour by this point. It's like, we got to get the cameras rolling. I really appreciate you coming. Thank you for making the time.
Yeah, thank you so much for inviting me. It was really great to meet you, of course, at Save My Family. We've talked a lot about how awesome that event is for parents, and just meeting that population, I think, is important. So I'm super excited to be here. Super excited.
It's gonna be great. So there are a lot of things. I have a feeling this is going to be first of many with the Central District. We were going to do, there are just a lot of topics, and today we're going to be going after vaping. And vaping in particular is one of those things where it's very personal to me, because I have a sibling who struggled with vaping, and I also have other family members who've struggled with substance abuse. And vaping is one of these things that spans all kinds of different industries, because it's not just tobacco. It spans tobacco, it spans hard drugs, it spans everything. Technology. And right. You can use technology to charge the vapes and just keep hitting them. And it's also a delivery mechanism that people get very comfortable with, because it can be innocuous. They're like, what did you just, somebody hits a little vape. What did you just ingest? Oh, it's strawberry flavored nothing. Right. So it's a recreational nothing. It's not even tobacco. It could just be a flavored thing, like bubble gum. But then it spans all the way up to hard drugs. And because we've been being desensitized to the actually delivery mechanism of inhaling something and then blowing out innocuous smoke, we don't think like, did that person just do drugs, or did they just inhale some like bubblegum flavor stuff?
Right. Yeah. You hit on a lot of different things that I'm constantly educating people on, right? So first of all, the technology aspect of vaping is a huge consideration. Why was this even created, right? There's arguments of it was created to help people quit traditional tobacco products. It was created because we live now in a technologically advanced world. And so why don't we just update our mechanisms and things that we are using day to day, make it look intricate, sleek? How can we sell these products? How can we profit? That's all the perspectives from a tobacco and vaping company, and even e-liquids. First and foremost, putting it out there right now, is every e-liquid you find on the market is not just flavor. There are so many different ingredients found in these devices. Nicotine, of course, is the addictive component that we see in traditional tobacco, but we're seeing even now 6-methyl nicotine just came out on the market. That's a synthetic form of nicotine with an extra carbonyl group on it, and it's supposed to be even more inherently addictive than the traditional synthetic nicotine that we're seeing in these vape products. So this...
Wait. You got to go back. 6-methyl nicotine?
6-methyl nicotine.
And this is a like lab-created nicotine molecule?
Yes.
That has an extra
carbonyl group on it. Yeah. So, I know there's going to be folks that are probably going to be listening to this that don't have a lot of organic chemistry background.
Yeah, I just blacked out for a second.
Yeah.
You're going to have to help me. And I'm all ears. Like,
sure,
treat me like a 5-year-old.
Well, first and foremost, so when e-liquids came out on the market with vaping products, right? E-liquid is that liquid nicotine, concentrated, sometimes even including THC, that you use in a vape device or an electronic delivery system that will provide this aerosol. I hate to call it vaping, even though that's the terminology that's used today, but really what it is it's an aerosol. So think hairspray. You spray hairspray, it's got these particles, fine particles that go into the air, and you're breathing it in. Vapor is water-based. There's absolutely no water found in these devices. So, but in these traditional vaping devices...
And they're using combustion to make it happen, right? Because there's a gel, and then they heat up the gel.
Yeah.
And then that gel goes into your mouth. And it's not water vapor.
It's not water vapor, one bit. And the whole reason why vape or vaping was talked about is because it's a less harmful term that people who've used these products use to define it. It's hard to say I'm aerosoling, right? It doesn't make sense. Right. And there's a fine line of us being able to say, okay, everybody knows it to be vaping. And so how can I make sure that when I'm discussing this with people, they know that it's not actual water vapor? It's, yeah, you're vaping because that's the terminology that's been used, but it's no water at all.
MTU Studios is the proud producer for the Ada County Sheriff Podcast, the Idaho Wildlife Federation Podcast, the State Representative Ted Hill Podcast, the Idaho State PTA Podcast, and many more. If you or your organization is thinking about starting a podcast, MTU Studios would love to help. Just check out mtustudios.com. Right. Okay. Yeah. So you're saying the original intention or the original selling of this product was essentially, hey, look, let's design something that helps get people off of smoking.
Yeah. But
these gels are infinitely worse from a nicotine standpoint, from an addiction standpoint, than cigarettes, right?
Absolutely. Yeah. What you find in the ingredients are, they won't even list the ingredients on the package first and foremost. That's the danger that we're seeing. Whereas with traditional cigarettes or tobacco products, you'll see on the bottom left-hand corner of a cigarette box, a white box with a black outline that says Surgeon General's warning, this can cause cancer. Sure. You don't see that in vape products. You don't see that in electronic nicotine delivery system products because it's not overly regulated like the tobacco industry. And that's honestly not anybody's fault. It's just that this product has not been around for very long. We're talking 15 years. Like traditional tobacco has been around for at least 100 years. And so, and we have to be very careful too when we talk about traditional tobacco and commercial tobacco products, because commercial tobacco products are an issue. Traditional tobacco can be used by Native American tribes, and we have to be very, careful about how we discuss tobacco products.
Right. Because contemporary tobacco products are far different than like 200 years ago tobacco products, right?
Exactly. Yeah.
Right.
Well, and what we're seeing now with, so when vapes first came out, okay, and I'm going to say vapes throughout this whole conversation,
sure,
but just want to revamp and say it's an aerosol. There's no water vapor, but most people that are going to be listening to this, they think it's a vape, right? But when vapes first came out, synthetic nicotine or nicotine salts were used because it helps them not have that harsh of a feeling when they inhale the vapor, or the aerosol rather. And so nicotine salts is the first synthetic form of nicotine that they created. So the tobacco plant creates nicotine, right?
Sure.
And then lab-made nicotine salts were the first go around. But now they're coming out with a new product called 6-methyl-nicotine that they're putting into these products. And it's circumventing the FDA's regulation because they're not able to identify that it's different than nicotine salts, even though they're creating in the lab and they're putting it out there. It's supposed to be more addictive is what they're saying. There's little research on it, of course, just like any e-liquid or electronic nicotine delivery system. There's very little research on those. But one thing I will point out is that traditional tobacco, it took us 50 years to see the long-term health impacts, right? But with these nicotine delivery systems, we're seeing in high concentrations of nicotine seizures, EVALI. I can go on and on about popcorn lung. There's all kinds of these.
Wait, what's popcorn lung?
So diacetyl is the main flavor that you find in e-liquids, most e-liquid products, and it's supposed to have a buttery flavor, right? And what diacetyl does is it, we're probably gonna have to cut this part out, but diacetyl.
Wait, why are we gonna have to cut this part out?
Because, so diacetyl is supposed to make other flavors more flavorful.
Okay.
Yeah. And so, fun fact, I don't even want to call it fun, but it is interesting. Back in the 1950s, Orville Redenbacher, the popcorn brand, they used diacetyl in their popcorn to create that popcorn flavor.
Okay, but if this is public knowledge, we haven't gone to anything bad yet.
Yeah.
Okay, great. Keep going.
Yeah. I'm just getting flustered and caught up.
No, we're good. Take your time. Take your time. Okay, so popcorn lung. Diacetyl was supposed to have a buttery flavor. It has been used in other commercially available products like Orville Redenbacher.
Yep.
Keep going. Yep. But nobody inhales Orville Redenbacher.
Exactly.
And if you make it in the microwave and you open that bag, not to put your face there because you're about to burn your nose off.
Exactly.
So you just open it so nobody's inhaling it.
Exactly.
Great.
Exactly. But the people that were working in this factory, this Orville Redenbacher factory, they were starting to have this bronchopneumopathy or this trouble breathing, and they would go in, they'd have x-rays done, and their lungs were clearly having some bronchointerstitial patterns where they just were not, it wasn't normal classified lung tissue.
Understood.
Right. And now looking retrospectively, with diacetyl causing popcorn lungs. So what popcorn lung is, it's an inflammatory disease of the lungs. And so they're putting diacetyl into these electronic nicotine delivery systems to help make the other flavors seem more flavorful. And this is the same deceptive marketing tactics that we're seeing by big tobacco and vaping companies that they've done over the past 50 years.
That's not even a deceptive marketing tactic. That's just taking something you know causes lung damage, putting it into something and saying, here, inhale this into your lungs. That's not even deception.
Well, and where I'm getting at with that is that it's what is causing youth to use these products. How can you attract youth? How can we attract our replacement smoker population, which is what they call them? They actually call our youth, and they've called youth over the generations, replacement smokers, because they're seeing that the traditional tobacco products were causing cancer, COPD, all these other lung diseases. And they're like, well, it's one in 4 people in the US are dying because of using tobacco products, right? And now they're having to replace those smokers, right? It's all about profit. It's all about how can they make money off of their products? How are they going to do that? Well, they're going to put flavors in them. Diacetyl has always been used, but it's now being used in combination with all these other ingredients. Again, not water vapor, other flavors, because there's thousands of flavors out there, but diacetyl is being used to help make those other flavors more flavorful and more attractive to youth.
And again, when we're talking flavors, we're talking like bubblegum, strawberry, watermelon. We're talking these like fruit punch flavors, packaged in very bright, cool color. I mean, almost identical packaging to the original. I saw a slide that actually had the original iPods that came in like all the different rainbow colors compared to all the vapes or you know, whichever brand they were, but a bunch of different, you know, like hypercolor things. Yeah. So with replacement smokers, then the specific intention is, okay, look, we've lost the battle with this generation and potentially future generations with legacy cigarette smoking. Yeah. And legacy cigarette smoking has a lot of negative drawbacks. First off, it stinks, right? Like it's on your clothes, it's in your hair,
we now
everywhere.
Know it to be unattractive.
Right.
It used to be a social norm.
Right.
You know, people, they marketed it back when my parents were, you know, in high school. They marketed it to be something sexy, something that would help women lose weight, right? And now we've changed that social norm where it's no longer sexy. It's disgusting. It doesn't smell very good. And yeah, exactly to your point. Now they're trying to replace those people who were using those products that are now dying because of COPD, lung disease, cancer, all the different health outcomes that you're finding. And they're using technology and what youth are most attracted to, which they're typically attracted to: candy flavors, Cool Whip, Ready Whip, treetop apple juice. I mean, you see these products, and I mean, the FDA has done what they can to regulate it, right? But they're seeing it as they come about, right? And so from a prevention lens, how can we target our youth populations and our parent populations to understand that this is the deceptive marketing tactics by this industry that are inherently targeting our youth or our replacement smokers?
Holy cow. Yeah. What was the hot news like 8 years ago or something when people started all of a sudden dying? Like people who had just started vaping or using these. I can't remember if it was Juuls. That's the other thing. The names of the companies, right? Like Juuls, like, oh, it's Juuls. Like that sounds really cool. Yeah, juuling. I'm juuling. Yeah. It's like, wait, what does that mean? Right. And then you find out, I actually had a student whose mom worked like way up at Juuls. Anyway, but there was a hot thing where people all of a sudden started getting like massive lung reactions. Am I misremembering that?
No, you're on point. It's called EVALI, which is e-cigarette vaping associated lung injury. And what they were putting in these devices, and I'll go through the generations here in a minute, but what they were putting in these devices was vitamin E acetate. Vitamin E, everybody thinks health, right? It's a vitamin. It must be healthy for me. But you tack on acetate, it makes it very sticky. And they're putting this substance in these devices, and typically they're THC devices, but we have seen it with nicotine. And vitamin E acetate, what it does when the user inhales on the device, that sticky substance covers these cells in our lungs called pneumocytes that secrete a lubricant for us to be able to expand and contract our lungs on inhale and exhale. And so, as you can imagine, you inhale a very sticky substance, it covers that cell, prevents it from secreting that lubricant to lubricate your lungs.
So your lungs become rigid.
Exactly. And you're not able to expand and contract your lungs. Who doesn't want to take a big, deep breath, right? And then that even can, gosh, this could go into a whole nother conversation about mental health, right? And breathing techniques and how important it is for us to sit down and be able to take deep breaths. And people are no longer able to do that because they were using these products, and it's irreversible. So, and how they were able to even find the vitamin E acetate in the lungs is they had these, typically someone under the age of 25, most of the populations that they were finding this EVALI diagnosis in were under 25 years old. We're talking about youth and young adults here. They went under a procedure called a bronchoalveolar lavage. And they flushed sterile saline into their lungs, pulled it out, looked at it under the microscope, did a brief cytology, and found vitamin E acetate in it. So it's definitive that vitamin E acetate is what was causing.
And is that like a post-mortem procedure, or are these people that are
they went under anesthesia
and they shot their lungs full of saline and then drew it back out?
Exactly. Yep.
Oh my!
It's a common procedure that they do, even in veterinary medicine.
Not common for a common. This is like
sure.
I'm a little congested. I'm not getting saline shot in my lungs.
Right.
This is like I presume this is a really specific effort to figure out like what the hell is going on in these lungs.
Yeah. Well, and what we were seeing was about 68 deaths. So what you're talking about over the last 7 years is 68 deaths, right, in the US, which is not a large population group, right? But it's growing. And we're seeing vitamin E acetate still in these devices. And I mean, we even had somebody from northern Idaho, a teen, I think he was 14 or 15, with a double lung transplant. And it was because of that. So it's dangerous to the lungs. We know that. And the really hard part about this too is if you can imagine a campfire.
Could I say something real fast? Okay. 64 people is not a large
68.
number. 68. Excuse me.
Yeah, it's not large.
That's not large. But who were they? Because if you're talking about teens and people in their 20s, like if you're talking about somebody who smoked their whole life and then at like 65 died of a heart attack or had lung cancer, it's like, all right, you got a lot of play out of that. Like you had plenty of education. You knew it wasn't good for you. And that's terrible, right?
Yeah.
But people make choices. We have agency. If you want to be an alcoholic, you get to be an alcoholic. If you want to smoke 3 packs a day, you get to do that too.
Right.
Fine. But we're talking about adults with agency and the capacity to look at a long-term ramification, say like, I acknowledge this trade-off and I'm willing to make it.
Right.
When you're talking about 68 people that are young, teens and 20-year-olds, it's like, okay, how educated and how much agency did those people have? Right?
Little to none.
Little to none. And if you have a 16-year-old who's dying from something like that, likely that 16-year-old got taken when they were like 12 or 13 by marketing companies.
Oh,
so
absolutely.
I agree with you that, look, 68 is not, 1 is too many.
Yeah.
68 is way too many. 68 is growing, but if you look at the population that it's affecting and then the long-term ramifications of all the people that haven't passed away, like a 14-year-old with a double lung transplant, get the hell out of here.
Right.
Like, you're going after our children.
Yep. 100%. Yeah.
I'm sorry, I interrupted. You were saying campfire.
No, that's great. No, 'cause you're getting my point here.
Yes.
Is that there's this deceptive marketing from these companies, and that's an intervention point, and we can get into that in a minute. But what I was going to get at too was like, if you talking about particles getting into the lungs and the deep lung tissue, right? You look at a campfire, and if you imagine it sparking off, popping, and you get those little flakes, those ashes, right?
It's the worst.
Very similar to combustible tobacco products like cigarettes, cigars, right? And you're inhaling those particles into your lungs, right? But with this e-liquid device, right, this aerosol, these particles are able to get deeper into your lung tissue, into the deep lung tissue in the bottom of your lungs. And it's making it harder for your lungs to be able to, what's the word I'm looking for?
Expand and contract, absorb oxygen, chemical, gas exchange.
I mean, just all of the normal physiological processes our lungs are supposed to be able to operate on, right? And I think that's what's so tragic about these vape devices, are that not only are they inherently targeting youth, but they're almost becoming more dangerous. You hear people all the time talk about how they compare traditional tobacco products and e-cigarettes, right? And how we don't know if they're more dangerous than traditional tobacco products. But in the last 15 years that these have really been on the market, we're seeing seizures, EVALI, popcorn lung, all these different outcomes. And people are gonna have. I'm interested to see 50 years down the road what the actual health outcomes are in people, and even mental health too. Yeah.
I mean, we're gonna see it all. Talk to me about seizures with vaping.
Yeah. So nicotine is a stimulant, right?
Sure.
So coffee is a stimulant, nicotine's a stimulant. Right. And in low doses, it can help you feel energized and you get that dopamine release, right? We could talk about the physiology all day, but in high doses of nicotine, if you can imagine, you have this enormous amount of stimulant in your body and your body's not able to keep up with it. Seizures are typically an outcome. And so I can't give you data on how many people that I know or have done in the research that are having seizures, but it is an outcome that we've observed. If you look at Idaho Public Television's Nick Sick documentary, I don't know if you've watched that yet.
No.
Highly recommend it. It was off of Millennium Funds. So all the public health districts worked with Idaho Public Television, and we put together an Idaho youth specific documentary on the vaping epidemic and what it's doing to our kids in our state. And there is a gentleman on there, Broden, who was having seizures left and right from using these products. And he's now on seizure medication for the rest of his life because of him using these products.
God, that's terrible.
Yeah.
And how old was he at the time when this started?
He was a teen, 14, 15 maybe. I'm not 100% sure. Yeah. Yeah. It's tragic. It's tragic.
And the marketing, one of the aspects of this that makes it unique as far as a marketing standpoint is not that they're marketing flavors. It's not necessary, and they are doing that.
Sure.
It's not just that they're marketing specific colors and
right.
Sleek designs and things like that. It's that the marketing can be employed in a place where parents cannot observe, which is specifically on teens' phones.
Yeah, absolutely.
So you have these marketing campaigns that go straight to social media, Snapchat, Instagram, wherever, and kids are consuming this marketing content.
Yep.
And parents can't even restrict it.
Yeah. Yeah. We're not only seeing it on social media, but we're also seeing it in actual stores, retail shops. So ironically enough, the National Youth Tobacco Survey found of all the kids that they surveyed that the most the area where they saw tobacco advertising the most was retail shops. And so we actually put together a map. We worked closely with, so we have a subgrant with Project Filter, the state tobacco control program, and they work closely with the University of Idaho. There's a gentleman or a ma'am up there named Helen Brown, who was able to do a web sweep of all the different tobacco and vape retail shops in the state of Idaho. And she mapped them in proximity to schools. So how many vape shops are within 1,000 feet of a school, right? And it's in Ada County alone, we're talking over 250 tobacco and vape retail shops within 1,000 feet of a school in Ada County alone, which is dangerous, right? When we're talking about where youth are seeing these advertisements. And you can imagine billboards, you name it. And so that's what's so frustrating from a public health perspective is that we've worked so hard to get the social norm against big tobacco, traditional tobacco. Right. And now we're trying to keep up with this very intricate, deceptive market of tobacco products now that we know is electronic nicotine delivery systems.
What are the age limits to buy? And there are rechargeable, there are cartridges that you can refill, and then they're just disposable. And these are distinct, they're distinct regulations on this.
Oh,
right?
Oh yeah. So in 2020, they passed a law. So it used to be 18 years old that you were able to buy these products.
Like a cigarette.
Yeah.
Great.
Now 2020, since 2020, they made a law that you have to be 21 to buy these products. Around that same time, though, they came out with a law that was specific to flavors, right? This is where it gets really tricky. So they came out with a law that said that any flavor refillable pod is banned except menthol and tobacco flavors. So what did the market do? They made more disposables, and now those are the most commonly used product by youth today.
Okay, so they were like, listen, you can't refill this without menthol or whatever, because they wanted to avoid the marketing tactic of the strawberry bubblegum treetop apple juice. And they're like, fine, we won't make it reusable.
Yep.
We'll make it disposable. So they have a little stick.
Yep.
They just charge it and then huck it.
Yep. So I'd like to see that change. It's all in the language, right? So when first generation electronic nicotine delivery systems was a disposable device, right?
Sure.
And then they moved into second generation was the pen, right? And this is where we started to see them being able to break it apart and put their own ingredients into it. This is where it really became dangerous with other drugs or other substances. THC really started being used in these products. You move on to the third generation, you have this mod, or what you would refer to as something you could break apart and modify. That's why it's called a mod. And it's a bigger tank. You can change how much aerosol you're getting out of it. That's really where we started to see the big vape cloud, right?
Right.
And then fourth generation is the Juul. So it's still a refillable, rechargeable, but instead it's a little pod that you can replace.
Sure.
Right? And then you move into the fifth generation disposable. And the whole reason why we went full swing is because of that law. That language was not put in that law that said, we need to ban all flavors and all electronic nicotine delivery systems. It was just the refillable ones. So disposables are the most commonly used among youth. If you look at the National Youth Tobacco Survey, you'll see that millions of kids report using disposable tobacco products or electronic nicotine delivery systems.
And it's so, okay, like if you saw a kid walking around school, like sipping on a hip flask, you'd grab them really fast. You're like, what the hell's going on?
Yeah.
Somebody's smoking, you grab them real fast because you can see it, you can smell it, the whole thing.
Right.
But with these, it's something that's completely innocuous. It's inert in a backpack, right? Nothing happens. It's not like there's any dead giveaway. It looks like a memory stick, right? Like they look like every other piece of technology that we walk around holding all day long. And they can just be, is there any limit to like how many you can buy? Is there a thing?
No. As long as you're 21 and you go into a retail shop, you can buy whatever you want. But we're seeing kids getting these from older adults off of social media. Social media is a big one where they're going on. Yeah.
All I got to do is go buy 1,000 of them and then go on to Snapchat as your like neighborhood delivery vape provider, which is a thing, right? Delivering things off of Snapchat. So then I know where you live. And by the way, I'm bringing you, pay me my premium, whatever it might
be. Yeah. So, and unfortunately, sometimes we're even seeing parents or guardians supplying these devices because they don't know. It's not their fault. They just don't know how dangerous these things are.
Their fault. It's definitely their fault. It's definitely like you're not. I'm not buying that one.
I personally, gonna be a new mom, would not be purchasing any device like this for anybody to inhale because the only thing we should be inhaling into our lungs is oxygen. That needs to be a norm. That needs to be a norm.
And nitrogen. Like we need a balance. We need, just say air. Air is better.
Yeah.
Don't straight oxygen, as we saw over COVID, is a bad idea for the lungs. Anyway, here's a thing. Is there any ability to distinguish? Say I catch an 18-year-old or a 16-year-old with like a vape, like a little thing. I'm like, hey, what is this? And they're like, okay, you got me. It's strawberry flavored nicotine. Is there any way for me to confirm or deny just by an average consumer cursory inspection that it is in fact nicotine or THC?
Well, there's THC test strips, which a lot of...
But if I'm just walking around, if I don't happen to have a test kit on me, I grab this thing, I'm like, I mean, I could puff on it, but like, I'm not going to.
Yeah, arguably, no. There's no definitive way for you to look at any product and say, oh, this has nicotine, or oh, this has THC, or it doesn't have either, which is not going to be the case. There's always nicotine found in these products. Even when they market them to have no nicotine in them, they have nicotine in them. And even kind of going back to the whole seizure thing that we were talking about, where I said nicotine in small doses is a stimulant, but then nicotine in high doses can cause seizures, right? And we are also seeing that with THC. But these products are marketed, 12 flow ounce e-liquid product, 50 milligrams of nicotine. We're actually seeing them tested at 300 milligrams of nicotine or more. That's a lot of nicotine. And it's also really hard to measure what a puff is, right? Whereas with a cigarette, you could probably say, it takes me about 2 minutes, 3 minutes to get through one cigarette on a cigarette break. Whereas somebody who's using a vape device, they're walking around with that for maybe a couple days at a time, and they're marketing these products to have 2,000-3,000 puffs in it. But how can you say that each user who's using that is actually doing that many puffs, right? Sometimes they're sitting on there and they're inhaling it for, an extended period of time. So how much nicotine are they really getting in each dose? That's significant concern.
Okay. Idaho has a very, very proud position on marijuana, which is, hey, it's illegal. Right?
Thankfully.
And yeah, great. And the Western states have done away with this. Obviously, we're seeing how that's playing out. And I have lots of friends in law enforcement that are hugely in favor of marijuana staying illegal. Okay, great. But introducing this as a cultural norm opens the door for people to completely wander down the street and be inhaling THC, which is obviously the active drug in marijuana. So it's like we have in effect found a back door so that, for instance, one big problem that a law enforcement officer told me who used to work in Oakland, he said, look, when marijuana was illegal, if we found somebody hanging out on the corner doing whatever it is they were doing, we were like, okay, grab them. They have marijuana on them. They have this. They're probably selling other things too. And you could start this chain of action that addressed the crimes, right? And address people. He's like, when marijuana became legal, the people on the corner that were originally selling it started selling other things, but we didn't know for sure, right? So we couldn't pop them on a small marijuana charge, and we didn't want to start pulling people over and wasting time on marijuana charges. And again, it was still illegal for people under 21. Right. So they could be selling a legal product to younger people. So they still had a gig, but it'd be like somebody standing on the corner with a bunch of alcohol. They're like, you can't arrest me. I'm 21. This is just alcohol. They're like, well, we think you're selling this to people that are 16. It's like, dude, you have proof?
Right.
So you had this legal product. There was a gateway for not only other drugs, but absolutely was a gateway to selling in a more legal, not reprehensible, but less, I'm losing the word. You couldn't arrest people essentially. It was a lot harder to arrest them.
Totally.
Isn't that kind of what we're doing with this? Which is we're entering this world where you're going to be happy, or at least desensitized to the idea of walking down the street. Like you see when you're driving, you look over for whatever reason. I don't know why you look over, but you look over and you see somebody, either on their phone or puffing on something and blowing out all this smoke.
Right.
You have no way of knowing if that's nicotine or if it's THC, but you do know that because you have no way of knowing, you can't do anything about it. So you're like, I'm just going to move on.
I see what you're getting at. Yeah.
Right. So the delivery mechanism of this e-cigarette, or excuse me, the vape, right? The delivery mechanism of this vape is desensitizing us to essentially be seeing people smoking marijuana and getting the THC in effect through these pens.
Right. Oh yeah. And we're seeing that in schools too. They're caught violating the tobacco and vape free school policy because they're caught with the device. They're exchanging devices with students, whatever the case may be. And really what it comes down to is, if you have a THC test strip, right? If you're able to test it and know that it has THC in it, then there's a different course of action that needs to be taken, right? Sure. And it also depends on the policy, right? That's written. The policy inherently says that we are going to get law enforcement involved because you're under 21 with nicotine, regardless of what it is, or if there is an illegal substance involved, law enforcement's going to get involved, right? So,
but that's only with schools. That's not for the random 22-year-old walking down the street. Absolutely. Like as a society, we should be more worried about the prevalence of this stuff because it's heralding in the age where we can see people puffing on something that's totally anonymous to us, but could absolutely be hard drugs.
Oh yeah.
Right. And a friend of mine had a little bit of a snafu with his daughter, and they had to go through some, training at one of the high schools. And the training yielded information in the spirit of, look, what people 20 years ago used to get with marijuana is not what they're getting now.
Nothing, yeah.
And not just with the marijuana that they're getting now, but things like vaping when it has THC. These are concentrations that you could never engineer into a like an organic plant that was, whatever. So it's bringing in, when I say hard drugs, even if it always remains THC, it could be a THC concentration to the level that could produce similar effects to doing much harder drugs.
Oh, absolutely. And we're even seeing fentanyl found in these devices. While not common, we're seeing fentanyl in these devices. Yes.
No.
Oh, yeah. There's been schools that have reported confiscating these devices and testing them to have fentanyl in them. While not common, it's on the horizon. And that's the danger, right? And we kind of discussed this before we even hopped on, is just like, the youth brain, the adolescent brain isn't done developing until they're at least 25 years old, right? That front part of your brain, which is responsible for impulse control, judgment, your personality, your behavior, all of that is not completed until you're at least 25 years old as far as development goes. And so when we're talking about any substance, alcohol, THC, fentanyl, nicotine, whatever, what have you, it will impact the way that portion of the brain is developed, right? And for a adolescent who is exploring who they are, right? You remember being an adolescent under 25 years old. You're trying to figure out what are you going to do with your life. There's the pressures of society, which unfortunately we're getting a perfect look at on our device, social media. That's a really hard time for an adolescent to be. Well, in general, I will say nobody should be using these products, right? But for somebody who's under 25, that makes it even more crucial and even more critical for their development and how they're going to be able to move about life. And so what we talked about was how any substance under that age, and actually the research shows under 18, they have an 80% chance of developing a substance use disorder later in life. How tragic is that? 80%. You start using one product, you have an 80% chance of developing a substance use disorder.
God.
Yeah.
What can be done? You have sufficiently horrified me. What?
Yes.
What can be done?
Yes. Well, and I mean, I'm horrifying you, and horrifying children isn't the answer either, right?
Because they're invincible.
Yeah.
They don't care.
Yeah. And so really what it comes down to
I used to drive without my seatbelt on.
Oh, yeah.
When I was like 18, I was like, I don't care.
Yeah.
What? I'm driving in my 1986 Honda Accord. I'm like, I don't care. Yeah. I would burn out all the time. I killed the clutch on it. I learned how to drive on a stick. Like, what an idiot. Yeah. And that was me at 18. Like, no seatbelt, peeling out, front wheel drive, champagne color Honda Accord. What an idiot.
Right.
God.
Well, and why, let me ask you, why do you think that is? Why do you think you decided that you didn't want to wear your seatbelt? You knew it was the law, but you were like, I'm not going to wear it. It's fine. Why do you think that is?
I mean, because I can think now and I couldn't then. I mean, there are a multitude of reasons.
We're talking about
like
the brain,
I was just an idiot, right?
Well, and we're developing, right? Our impulse control, our judgment, those areas of the brain that are not done developing, right? And sometimes we're even seeing it more than 25 years old. 25 is really what the research is telling us. But what can be done, to answer your question, is how can we help youth build skills to resist peer pressure? Because a big component of that is looking around at their peers. What are the peers doing? What is on social media, right? And how can we identify marketing tactics by these companies? They don't know that these companies are marketing directly towards them. These companies just want to profit. And these kids don't think that far ahead, right? Because they're not in the real world yet. They don't have a job, maybe. Some of them do. They don't have bills to pay. They don't have a family that relies on them yet. They're still young and trying to figure out who they are. And so how can we help them build those skills? And on top of that, coping skills. Coping skills is a huge portion of why youth are using these products. And if you look at the data, National Youth Tobacco Survey, I'm going to refer to a lot because it's a highly recognized survey that really dives into the U.S. demographic of youth who are using these products. 50% of them will say, it's actually a little bit over 50%, a little bit over 50% of middle schoolers will say that they started using these products first because they were curious and because their peers were using them. But then when you ask them the question, why are you continuing use then? And it's because they report that they're stressed or they're anxious or they're depressed. And that in itself gives you the whole idea of what the bidirectional association of nicotine, anxiety, depression, all those things, how they're intercorrelated, right?
I love that term bidirectional. Right. Because it's like you go to one and then it causes more of the other.
Exactly.
Right? You're stressed, so you hit the vape, and then the vape causes, and that chemical causes you more stress. hit it again, boom, bidirectional.
Exactly.
That's great.
Yeah. And so how can we help? So it's not only how can we target youth that haven't used these products yet, right? Which is where I'm coming from, is the prevention lens, the upstream prevention. But how can we help those youth who are already addicted to these substances? Because like I said, there are high concentrations of nicotine found in these products. It's more readily available. It's easier for them to hide, and they're getting more access to it in their 8-hour school day, right? Which is not to the school's fault. This is really, it's a cumulative fault of how this is even legalized and how are these products even being developed, right? And so
and the 200 smoke shops within 1,000 feet of schools in Ada County.
Yeah. In a perfect world, it would be amazing to be able to say, within this mile radius, we're not even going to put a retail shop, right? Having zoning codes, policy, that kind of stuff. In a perfect world, that would be excellent. But we don't live in that kind of world. And so considering those things that we don't have control over, some of us don't have control over, how can we help, if we're working directly with youth, we're working directly with parents, how can we help them understand that coping skills is a necessity? And helping them build skills to resist peer pressure is a necessity. And helping them be able to identify these marketing tactics is a necessity. And so kind of going back to your question, I know we talked about how, we both have ADHD and we're like, this is going to be a fun conversation. It really comes down to, how Catch My Breath. Catch My Breath is a evidence-based youth nicotine vaping prevention program. And all the public health districts in the state of Idaho and across the U.S. are working on getting this incorporated into youth affiliated organizations, schools, what have you. It's a completely free program. And it does that. It does exactly that. It helps them build those skills for them to be able to say, actually, I'm going to say no to this. And here's my reason why. Or I don't even have to give a reason, and build that confidence for them to be able to say, I'm not going to do that. I don't need to do that. Right. I mean, when I was in middle and high school, I was surrounded by kids who were drinking, smoking, what have you. I mean, I come from Washington State, and when I was in high school, that's when they legalized marijuana in my state. And how can you have confidence as an individual to say no to your peers? That's hard for someone who's still developing and understanding their personality and their place in the world, and how they can control their impulses and control their judgment. Those are things that while their brain is developing, let's nail it. Let's put it on the target now and let's work on it. And we don't see that a lot in schools. We see it in sports. We see it in outside of school. And I will say that there are some schools that are recognizing that, and they're making an active effort to incorporate that into curriculum. But that's the challenge, is trying to get people on board to understand that those are the interventions that we need to do.
Right. And there's a problem I think a lot of people run into when we're asking more and more from teachers, right? It's like you're just scope exhaustion, right? You can't keep adding additional things on. But this is one of those things that is readily available and being used in an academic setting because they're removed from parents and they're able to get away with it. It's being spread because you can exchange in an academic setting, and it is directly affecting the academic setting, right? Like imagine a dress code, right? Like you have people dressing very productively or whatever it is, it's going to affect the education system. And that's the environment. Right. And that's one of the primary arguments for dress codes, which is like, look, we can't have people, acknowledging who people are at 16. It's like, you can't function appropriately if you have, I used to have this in one of my SAT classes. I had this kid, Brandon, and Brandon really liked girls. He was 17, totally great kid. And I only had a 6-person class. When it was only guys in there, Brandon's great. Like he's like talking trash, having a good time, function seamlessly, right? Get the work done. But there was this one girl that would come sit next to him, and you could see it was like a switch. He was like, and he would start doing things like she'd raise her hand for a question. She's like, "Hey, how do you do 17?" He's like, "Oh, I mean, I don't know. I could." And he just slide over like, "Brandon, stay in your seat." Like, But again, you have basic distractor things where it's like, listen, I understand that schools might not want to be engaged in now actively pursuing and preventing vapes, and it may be beyond the scope of like the math class you're in.
Yeah.
But the reality is it's going to be far harder, far more difficult to teach math
focus.
if you don't nail down these things.
Right.
So it still ties back to the educational performance and therefore theoretically in the scope of the educational institution.
Absolutely. Well, and using substance we know is detrimental to an individual's ability to learn and prosper.
Right.
And that's written into policies within schools, is we recognize that the use of substances can inherently be detrimental to an ability of one's to learn and prosper in life.
Right.
And the whole point of the education system, to my understanding, is that we want to build these individuals to be active citizens in society and be contributing citizens in society, right? And also to develop skills for them to understand what their purpose is and where they should go and
right.
what are they going to do with their life. And so that's at least how it should be. And so when we're not considering that these students are struggling with an addiction, or there's these products that they've got their hands on, and we're not addressing the coping skills, we're not addressing the peer-to-peer influence or how marketing is really impacting these kids, we're not giving them the best ability for them to prosper and learn.
Right. Because again, as you're saying, browbeating or scaring them is not going to work.
No.
Like you have to go straight to it. It's like the reason this happened is because you were marketed to and your friends were likely doing it too.
Well, let me tell you, one of the best opportunities in the state of Idaho that Idaho Public Television has put on the last 2 years is this public service announcement contest among peers. And we understand that it needs to be peer-led, right? We changed the social norm with traditional cigarettes and tobacco products, right? We no longer think it is sexy to smoke. We realize that it's unhealthy, it stinks, it's just overall not appealing to people, right? How do we change that now with this generation using these products? Well, we need to have a peer-to-peer influence, right? Having an adult go into a classroom and be like, this is bad for you, this is why, is not going to really get across to kids. And so Idaho Public Television puts on this public service announcement the past 2 years. I don't know if they're going to do it in a third year, but basically these kids, they go and they create a 90-second video of them talking about the dangers of vaping or why they shouldn't, in whatever fashion they would like. And they're entered into a drawing to win at least $2,000 grand prize. And that's a lot for a kid from 13 to 18 years old. And
dude,
so
I'll enter a contest for $2,000.
Right.
That's a lot for me.
Well, and one of the grand prize winners this last go around, which was just announced, I highly recommend anybody to go to IPTV No Vape. It's KNOW Vape is their campaign. I highly recommend you go look at the grand prize winners this last year, because one of those grand prize winners actually from the Ada County area, this is statewide contest, by the way. But one of these contest winners, they said, it's okay to want to experiment at this age, but don't do it with vape, you know? And it's that peer influence. Imagine being a 17-year-old and you have another 17-year-old that creates this video. They're winning $2,000 on top of it. They're going to have it remixed by Idaho Public Television, put all over social media, right? Like they care about those things. Yeah, right. And
you got to meet people where they are.
Yes. Right. Exactly.
And it was, I mean, again, not to get too heady, but we were talking just before about the three pillars of persuasion as laid down by Aristotle, right? Yeah. Like pathos, ethos, and logos. And you have to establish a character that people will actually listen to. Right. And so for young people, there's no character that's more influential than those of the same age bracket.
Absolutely. Right. I mean, even for me as an adult, I think about people my age, you know, and what influence they have over me. And I'm fully developed now, according to the research, right? I argue that sometimes, but I mean, the people we surround ourselves with matter.
Right.
And I know parents know that, and I know teachers know that, and the general population, I feel like that is a common understanding. Right. But how can we make that more apparent for kids as they're developing and learning? And really it comes down to it being a peer-led approach. And Idaho Public Television is doing it in the face of, we know that social media is a problem. We know that the deceptive marketing tactics by these companies, not just retail shops, it's also on social media. So how can we combine the two? How can we have it be a peer-led approach and use social media at the same time to really target these kids, right? We need to be doing the same thing that tobacco companies are doing. Just we need to do it better.
Right. Katie, listen to me. You've given me so much information today. Have we left out anything that you really want to hit?
There's so much.
Listen,
much.
We don't have to solve the problems of the world in one episode. Please come back again. I really care about educating parents in a myriad of things, because parents, the world has changed. The world has changed. This is a perfect example. It used to be just, you knew when your kid was smoking because you're doing the laundry.
Right.
And you're like, hey, your clothes stink like cigarettes. Or like when I was an idiot, right? And I turned 18, I bought like a couple packs of Swisher Sweets or Black and Milds. I don't know. Black and Tans and ice cream. It doesn't matter. But the point is, like, I tried for a hot second. I'm like, oh, this seems cool. Like, whatever. Right. And there was a smoke shop near my high school. So these are things that I messed around with briefly, but it was not, there were negative feedback loops. Right. So even I regulated myself as like, okay, first off, this tastes like crap. Second, my clothes stink, so I'm going to get in trouble. And there were all these problems. Parents were still in charge.
Yeah.
We've removed them.
Yeah.
Because parents don't know, one, the risks involved with vaping.
Right.
They don't know the mechanics of the vaping.
Right.
They don't know the things to look for. And they don't know how to address it. We need to re-empower parents.
Absolutely.
Right? We need to help educate them. And again, to the degree that we can here on topics like this, I just so appreciate your help with that.
Yeah, absolutely. I mean, parents is definitely a demographic we're trying to hit, and it's extremely challenging with the world we live in today. Right. We know that parents are having a hard time showing up to even things that they want to show up to because of work schedules, what have you. And then, there's also on the other side of things where parents just don't show up because they don't care, right? But really what it comes down to is exactly to your point, is empowerment. And I would even argue envisioning, telling these parents that I envision you being able to help your kid with this.
Right.
It's not that I have power that you don't have that I want to give you. It's more so like, I can see the power that you have. You as a parent are so valuable. You were able to bring this child into this world, and you have every capability to help them through this and support them through this, whether they're already addicted or whether they haven't even touched these products yet. We want to help you build the skills too. Right? We want you to be able to identify those marketing tactics, and how can you help your kids with that? I mean, you talked about this awesome curriculum you're putting together with Officer Gomez, and how it'll help parents really understand and get those little tidbits of what really is going on in their child's social media. Right.
Parents have to be educated to a meaningful degree in a way that they are willing to consume, that will put them back in the driver's seat. Because I absolutely do see the same thing. I have a vision of parents taking control again.
Yeah.
But they need information.
Yes.
Because the world has changed. It's not, going from 1901 to 1990, things were pretty much the same. It's like, stay away from drugs, stay away from bad boys, like whatever it is.
Right.
Now it's like, I don't even know the things to look for.
Yeah.
So listen, we got some work to do. This is going to be great. Thank you for coming today. I appreciate you. Well, first of many. Thank you.
Appreciate it.
MTU Studios is the proud producer for the Ada County Sheriff Podcast, the Idaho Wildlife Federation Podcast, the State Representative Ted Hill Podcast, the Idaho State PTA Podcast, and many more. If you or your organization is thinking about starting a podcast, MTU Studios would love to help. Just check out mtustudios.com.